I'm always amazed how many patients I've cared for here that actually were born here. This is their community. They've been living here forever. And their same primary care doctors have been taking care of their family for so long. So having a group of people that can communicate with each other, keep you in your community, and still give this multidisciplinary care, it's not heard of, and it's what's the best.
We continue in our series introducing you to your team in your fight against cancer. Garfield Medical Center and House Medicine.
We're telling the community what they need to know about cancer. You heard our conversation with Dr. Anamale. Can you tell us more from your perspective?
Sure. So as you've heard already, cancers of the hepatic-pancreatic-biliary region can be very complex. And by complex, I mean that it requires a multidisciplinary team to take care of that patient. There are times when you need surgery. There are times when you need chemotherapy or immunotherapy. There are times when you need ablative procedures. There are times when you need radiation. There are a variety of treatments, and oftentimes it's a combination of those things that allow us to get the best outcomes. The challenge is oftentimes in the community that patients are not having easy access to all of those things in a timely manner. And I think one of the other challenges is oftentimes there's not good communication between the different specialists who are taking care of that patient. And ultimately that can lead to less optimal outcomes. So I think one of the challenges that I think we have been able to address as a team is being able to take care of patients together, all the specialties under a roof. And by doing that, giving that patient the best potential outcomes.
How new is this idea that House Medicine will come and work with Garfield Medical Center so that it is one location where a member of the community can come here for all of their needs?
So I think in the community, it's pretty unheard of. We know that in Los Angeles, when a person has to get regular care, whether it's chemotherapy or daily radiation, or they have to go up for many surgical visits, going across town is it's not the best care. It's care in the community is the most important. Being around your care team from your community, including your primary care team, the hospital where you know everybody. I'm always amazed how many patients I've cared for here that actually were born here. This is their community. They've been living here forever. And their same primary care doctors have been taking care of their family for so long. So having a group of people that can communicate with each other, keep you in your community, and still give this multidisciplinary care, it's not heard of, and it's what's the best.
Thinking about sports, it's not necessarily the group of 5 people that have the best 5 individuals. It's the best team that will win. Is that kind of true for your team?
I think that's perfectly said. It's all about coordination of care. It's about communication. And that's really what coordination, that's the same thing that happens on the field. So I'm happy to say our team has very good surgeons, but also the follow-up care after that is really important.
If you don't have to drive to UCLA and park there, you don't want to do that. If you can do everything here at Garfield Medical Center, I think you would agree. It's the best thing to do. Well, I need to meet other members of your team. So thank you very much, Dr. Shinde, for your time.
Thank you.